Hello everybody, my name is Dr. Marty Mrazek from Elite Athlete Services. Looking forward today to spending a bit of time with you talking about concussions and the concussion management protocol in the HSL and in the JPHL. Just to tell you a little bit of who we are, Elite Athlete Services is both myself and Cody Cuthill, where we are focused on providing elite services for athletes, which includes supporting athletes to reach their potential. Our emphasis is on many factors, including mental, cognitive, and physical development, as well as expert guidance for individuals in a supportive environment tailored for elite athletes. Just to tell you a little bit about who I am, my background is I'm very privileged to have worked at all levels of sport for the last number of years. I'm a clinical neuropsychologist by training, which means I'm a psychologist and I've specialized in brain-behavior relationships. I'm a professor at the University of Alberta, and I've had the good fortune of consulting with the NHL for about 20 years, with the Canadian Football League, and with the Edmonton Elks Professional Football. So for today, we're going to spend a little bit of time talking about concussions and talking about the policy itself. Just to give you a bit of background, when it comes to our understanding of concussions, there's been a lot of changes in the knowledge and information about concussions over the last years. The most latest international guidelines come from Berlin in 2016, when a number of researchers got together, looked at the ongoing research, and came up with some consensus guidelines that are designed to help organizations like yours to have a concussion management protocol and to help individuals understand what are the best things to do in order to both educate, assess, and then help athletes return to play after they've had a concussion. As I said, there's been a lot of things that have changed in the last number of years, and you can see here that laws and policies are now in place. Back in 2014, in Canada, there was a recommendation that all sport organizations should adopt some type of program that helps with athletes understanding the steps to return to play. In 2018, the province of Ontario brought it into law, where now you have to have specific policies in place that help identify both educational elements, assessment elements, and then return to play guidelines. You can see that Hockey Canada is also very supportive of these efforts in terms of having specific objectives related to concussions. And you can see them on the screen there, but these are generally designed to reduce the violence of the game, to reduce head contact, and again to provide the cutting edge education and prevention and recognition of concussions. So we're going to talk about these things today. I think it's important to note that when it comes to the topic of concussions, there certainly has been an awful lot of media publicity about this. And some of the media publicity has been good, but some of it has not. And in a sense, this whole talk about concussions has left a bit of a black eye on the sport of hockey and other collision sports, which I think is really unfortunate. I love the game of hockey. I played when I was a youngster, and I believe that hockey is a fantastic opportunity to build life skills, to build character, to develop team concepts, to develop physically, mentally, emotionally, and spiritually. And that's why I think it's great that the HSL and the JPHL have taken these initiatives to really develop a concussion policy. You can see the details of it here. We're going to go into that information. But again, kudos to all of you that are going to be working towards implementing a concussion policy. As I said before, I think there's some important things that we're going to talk about related to the concussion policy. Some of those are education, some of those are assessment, management, and return to play. All right, let's talk a little bit about concussion education. There is certainly a lot of information out there. If you were to Google concussion today, you would get over 20 billion hits in just less than a second. So it tells us that there's a lot of information. Some of it is helpful and some of it is not. JPHL and HSL are going to be providing specific education sessions about concussions. Today the focus is on the medical designates that are directly involved in managing concussions, but there will be more education about that. And I think it's really important and helpful for everybody to understand what we're talking about. Here we want to talk about the definition of a sport concussion. Maybe you've had one, or maybe your son or daughter's had one, or maybe you've seen somebody that's had a concussion. Well, when we talk about the actual definition, you can see there, it's a traumatic brain injury induced by biomechanical forces. That means that it is a type of brain injury, typically a smaller or a less impactful brain injury, but it is still classified as a brain injury that's induced by biomechanical forces, which just means movement of the body, created movement of the head, which often moves the brain inside the skull. And so that is those forces will be what causes the concussion. I have a little bit of a video here that I'm going to show you that talks a little bit about that.
A concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes your head and brain to move rapidly back and forth. This sudden movement can literally cause the brain to bounce around or twist in the skull, stretching and damaging the brain cells and creating chemical changes in the brain. What you might not know is that these chemical changes make the brain more sensitive to any increased stress or injury until it fully recovers. A concussion is a type.
All right, so hopefully that gives you a little bit of information about what we're talking about. Again, there'll be lots more education about concussions coming up. Let's talk about the process in place, the policy that's in place. The definition is any time that there's a suspected concussion, the policy is that you want to remove that player from play. Now, I understand that sometimes it's a bit of a judgment call, but we're going to give you some guidelines here that will be helpful for that. When a player is suspected of having a concussion, there's several things that the medical designates need to do. One of them is to administer the SCAT, or the Sideline Concussion Assessment Tool. You're going to be learning about an app called HeadCheck that has all the details of the SCAT on it. It's an electronic app which makes things very quick and very easy to use. All the player information will be in there. Anytime a player is suspected of having a concussion, the medical designate should undertake the SCAT testing. HeadCheck will give you an indication of how the player is doing and whether they pass the test, that is, they match their baseline testing, or if there's cause for concern. The other part of your assessment will be looking for visible signs. And the visible signs you can see right there. Visible signs are any time a player sustains a blow to the head where they lie motionless on the playing surface, they have observable gait or balance difficulties, there's evidence of confusion or they don't respond, and there's a few questions that I want to go over with you, a blank or vacant stare, and that sometimes can be a little hard to differentiate, but often if you've seen a player with a concussion, you know that they just don't respond. They're looking at you, but it's like they're looking through you. Or evidence of any type of seizure activities. If there are visible signs, it's important to note those, and the player should be removed to play and not returned. When it comes to the signs of disorientation, so when you're talking to the player, there's a few questions that you want to ask. Their name, where they're located, the period, the time within an hour, and if they have some understanding of which team scored last. Those are important indicators about orientation. If somebody is disoriented, they're not going to know who they are in time, person, or place. And those indications that are suggestive of a concussion. Okay, so let's talk about specific steps. You've removed the player from play, you do your assessment. Scenario 1 is a player passes the SCAT. There is no evidence of visible signs, and you, as a medical designate, feel that they're ready to return to play. That's great, they can return to play, but we do want you to follow up and do a repeat assessment within about 24 hours. In another scenario, where a player does not have visible signs, however, as you go through the SCAT with them, there's concerns about their level of orientation or they do not pass the SCAT. In those cases, the player should not return to play. And also, they should undertake a 24-hour assessment. In another scenario, a more serious scenario, where a player may demonstrate visible signs or they fail the SCAT, the player should never be returned to play, and we would recommend that individual seeing a physician. What do you do after that? Again, we do want to see those players undergo a 24-hour reassessment with the SCAT, and then at that point, again, you as a medical designate has the decision-making capacity to decide what to do. In most cases, players who undergo the initial SCAT and they're fine will do fine on that 24-hour, and in that case, they can return to play. However, in some occasions, symptoms start to show up later or after the event. And in that particular case, if there's any concerns or they do not pass a SCAT, then in that particular case, they should not return to play. They'll need a physician's note, and they should go through the return to play process. So again, anytime a player passes the SCAT at that reassessment time, that they can be returned to play. But if there's any questions or concerns, you as a medical designate needs to guide that player and their parents to see a physician before they can return to play. In the other scenario, where a player is initially pulled from play, they're going to undergo another SCAT. In that particular case, they need to, because they've been pulled from play, they need to go through the return to play protocol that we'll talk about in just a minute. Obviously, in the case of a more serious concussion, where they've seen a physician immediately, they need to go through the return to play process. What is the return to play process? There's a few things here. You can see the diagram, but essentially, the first starting point after somebody has been pulled from a concussion, the day after, is what we call symptom-limited activity. Now, a few things to clarify. It used to be we recommended people would go to a dark room until their symptoms improved. We've realized through a lot of research that that's not a good idea. So symptom-limited activity means doing the same things you normally do, but at a much less frequency. It's okay to use your phone. It's okay to watch the TV. It's okay to do some activities around the house, but we want you to just limit that and be very careful for monitoring the symptoms. Things like headaches and dizziness that sometimes are quite present early on. If the athlete is able to tolerate that, then the next step is to do light aerobic activity. And by light activity, we mean the heart rate should never be above 125 or 130 beats per minute. It's okay if they have some symptoms to start that activity process. We've actually found, studies by Jack Letty, have been very helpful to saying that early rehabilitation, as long as you're not evoking the symptoms, can be quite helpful. So step 2, symptom-limited, mild activity. Step number 3 is sport-specific activity. So if the player is making some progress, they're feeling better, well, then they can be back on the ice. Stick handling drills, skating drills. Again, we don't want to do anything that evokes the symptoms. So if your player starts to have really bad headaches or starts to feel dizzy, what we want to do is pause it and come back the next day and do that same activity. So if you pause activities, you're going to start at the same step you were before. You do not have to start over. Step 4 is reintegrating into team activities. That's where you use the yellow jersey or the red jersey to be a part of team practices, obviously avoiding any hitting or contact to the head. Step 5 is full practices. So that's where a player is doing their normal activities. It's usually at step 5 where we'd want somebody to see a physician, and then step 6 is returning to play. Hopefully that answers all the questions that you have about the policy that we have in place. We hope you have a fantastic year and a great season. Thank you.